Hi, my group is from the Douglas County Health Department and we'll be presenting our community assessment project based on Tuscola, Illinois. Starting off with history, during our windshield survey in Douglas County, we noticed many fast food restaurants, but only one grocery store. This limits access to healthy food options and encourages people to choose convenient, less nutritious meals. The lack of affordable grocery options contributes to a food desert, increasing the risk of obesity and other health problems in the community. Some data and statistics. Douglas County was officially created from parts of Coles County on February 9th, 1859, and was named for Illinois Senator Stephen A. Douglas. In 1860, the county had a population of 7,140 and relied mainly on mills and farming. Today, agriculture remains important, but the economy has expanded to include manufacturing, healthcare, and service jobs. Moving on to demographics. During our time in Douglas County, we noticed that most of the people in the community were older adults. They were seen at the parks and grocery store, while younger people were less visible. The town felt quiet, steady, and close-knit, which is common in smaller communities with long-term residents. These observations align with data showing that Douglas County's population is stable but gradually aging.
Going off Kelly for data and statistics for demographics, in comparison to the state of Illinois, Douglas County has a slightly younger population and lower income levels. In 2023, the median age in Douglas County was 38.9 compared to the Illinois median age of 39.5. The county's median household income was around 74,000, which is below the state median of 81,000. Even though Douglas County had a small decline in population of 0.14% within a year, the county's household income grew by 10.4% during the same period, suggesting some local economic improvement despite a smaller, more rural population. And for ethnicity, some observations that were made while driving through Douglas County for the Windshield Project, we observed that the population appeared to be predominantly white. In public areas such as parks, grocery stores, sidewalks, and the post office, nearly all of the individuals we saw were white, with little visible racial or ethnic diversity. These observations suggest that Douglas County may have a largely homogeneous population in terms of race and ethnicity. For data and statistics on ethnicity, the top four ethnic groups within Douglas County are, in order, white, other, white, and then Black or African American. As of 2023, Douglas County's population was predominantly white with about 17,000 residents. That's around 24 times more than any other group. In contrast, Illinois is more diverse with roughly 60% white residents statewide.
All right, so I did values and beliefs. Some of our observations included that there were many different Christian churches, including First Christian Church, shown on the right, as well as the Church of the Nazarene. Um, so based on that, it appeared that Christianity was very prominent in Tuscola. And then to add on to that, there was also many references in bulletin boards, such as the ones we saw in Kirby Foods that had references to Christianity. Um, there were also many crosses prevalent within the cemeteries, especially like in engravings on the gravestones. We also noticed that there's a huge reverence for history and an emphasis on patriotism, as evidenced by this memorial that you can see on the right of commemorating victims of 9/11 and Pearl Harbor. And then lastly, we also noticed that many American flags hoisted in front of Tuscola homes. And then we've also got some data and statistics. There's not many statistics regarding Tuscola itself, but I was able to find some about Douglas County, and a lot of that showed that the majority of um, religious residents were a part of evangelical Protestantism. So that number was 6,100, and then the second highest was mainline Protestantism, and then Catholicism following along with 2,100, and then other religions was about 130. And then the highest proportion was non-adherents of any religion, which was around 6,600. And then we also looked into the 2024 presidential election, which showed that about 72.3% of Douglas County residents voted for Donald Trump, whereas only 30% voted for Kamala Harris. This showed us that a big majority of Douglas County residents voted Republican or are conservative leaning or conservative. And then our top three identified health problems include behavioral health. Our goal would be to expand that because currently Douglas County only offers two mental health providers. Our second problem is food insecurity. We noticed that there's only one grocery store within Tuscola, that being Kirby Foods, and we want to improve access to healthy and affordable food, so we would want to increase the amount of grocery stores. The last problem is public transportation. There were no bus systems or train systems besides dial-a-ride, and we want to increase the public's access to public transportation so that they can get to places without needing a car.
And community health priority focuses on the increased risk of obesity among adults older than 19 and younger than 65 in Douglas County. Some risk factors to obesity could be lack of physical activity or exercise, limited access to affordable and healthy food options due to inadequate resources to the community or overall limited public transportation, and then insufficient education or teaching on a healthy food diet. So the county I plan identified income, employment status, as well as transportation limitations to be contributing factors. We also noticed within the windshield survey, there was very limited public transportation. Some examples of this were door-to-door rides by request. Sidewalks were present, but they weren't overly utilized. And then bike trails, which weren't actively used at the time. Then the nutrition options are overall limited due to there being only one grocery store in Tuscola, which is Kirby Foods. And we noticed that the healthy food options, such as fruits and veggies, were significantly more expensive than the unhealthy food options. So this concern is supported by the I-Plan data, showing a 30% obesity rate among the Douglas County residents. Obesity was also listed among the top 5 health concerns in the county. So moving on. For our community level intervention to address the previously stated health priority, we decided on a community wellness center. So the location of this wellness center should be accessible to the community, such as a location in the middle of Tuscola. Individuals could walk to the center or they could find other modes of transportation, such as biking. And then within this community wellness center, there should be an area to exercise, similar to like a gym. There could also be nutritional workshops, which would educate and teach on local, affordable, or healthy food options in the community. Lastly, there should be like a designated area to provide health screenings to Douglas County residents. This could include vital signs, BMI, which we could obtain from their height and weight, and then blood tests, which we could check for blood sugar or cholesterol. So this intervention would be categorized as a primary and a secondary intervention. The primary level intervention would be due to the accessibility of exercising, which optimizes their lifestyle habits. And then the nutritional workshops, since they provide education to the community. Then the secondary intervention would be the health screenings, since this screens and detects diseases to be overall proactive.
Okay, as we go into our subsystems, starting off with number one, this is on nutrition and food access. We'll start by going over our windshield survey observations, specifically focusing on our strengths. So, one of the most noticeable findings was that Tuscola has a full-service grocery store known as Kirby Foods, and this offers a variety of produce, meat, and even some cultural items. So we also observe the presence of a local food pantry ran by the United Methodist Church, and this supports families in need. Additionally, there are multiple fast food spots, gas stations, convenience stores, and even some small local businesses that offer food products. Overall, our observations show that Tuscola has several food sources within the community, and these findings are what ultimately helped us identify two strengths within our subsystem. So, starting off with strength number one, this is the presence of a full service local grocery store. So, Kirby Foods allows for direct access to fresh and affordable foods without requiring individuals in the community to travel to surrounding towns to get the groceries that they need. So, this reduces transportation barriers and makes healthy choices much more realistic for families, especially those with limited time or resources. And because nutritious foods are physically available in the community, this strength directly supports our health priority. Improving nutrition always begins with access, and having a grocery store in town creates a great foundation for healthier eating habits and better long-term health outcomes. So now going into our second strength, this is the availability of community resources, including the Social Assistance Ministry, also known as SAM Food Pantry. And this is offered through the United Methodist Church, as pictured on our right over here. This pantry provides a safety net for residents who may be experiencing food insecurity and also shows that the community has a supportive culture where local organizations are able to step in to help. So, by ensuring vulnerable populations still have access to food, this strength promotes nutrition equity and directly supports our health priority by making sure that all residents, not just those who are financially stable, can obtain food and work toward healthier eating patterns.
Now we're going to be talking about our first subsystem's weaknesses, so limited access to healthy and affordable food. So although Tuscola does serve as a main town in a rural county, they do have limited grocery store options for its residents. So this can often lead to higher prices for fresh foods, and this could lead for families to have a difficult time in maintaining healthy diets, which would include fruits, vegetables, and whole grain. And this can also lead to health issues like obesity, diabetes, and high blood pressure. For my pictures, I did choose Kirby Foods, which is one of the grocery stores, and Lambo's Truck Stop and BP gas station. And fun fact, when we were into school, we counted three total gas stations, one convenience store, and one grocery store, just to put in perspective how little options they do have for their residents. Next, I want to talk about limited nutrition education and awareness. So it's not easy for a lot of Tuscola residents to maintain nutritious information like healthy eating, meal planning, and affordable nutrition. Although schools and community centers do offer limited nutrition focus programs, they're usually dependent on age or they're dependent on qualification. Like, for example, when I went to the Douglas County Health Department's website and I searched up nutrition, the only thing that came up was programs for those who qualified for the WIC program and not for all of its residents. So without consistent education and nutrition, these families are not able to make healthier food choices using the limited resources that they have available. And marketing for cheap processed foods does tend to be more common in these small rural grocery stores and gas stations, and it can influence them into eating habits that are less nutritious. Like, for example, I chose the signage in the Kirby Foods in Tuscola. It says save time and take dinner home. And the prices are reasonably priced, but the only really options that they have is fried chicken. So by saying save time and by making it at a good price, it just shows how convenient some of these food options are, even though they're less nutritious for these families. Also, there's a big signage outside of Lester's Candy Kitchen. It's a big red signage. It draws your attention and it's telling you to drink Coca-Cola, which is obviously a soda, so not as healthy as it can be. And they're offering it for 5 cents. So it's just
showing like if it's that cheap, why not get it? But there's not a lot of nutritious billboards or signage around the county that we saw. Lastly, I want to talk about economic and resource inequality. According to datacommons.org, um, the median household income in Tuscola is 8.7% less than the US household median income, which is 89,730. And it does say that 5.7% of the Tuscola residents do still live in poverty. So it does make it hard for these residents to afford high quality groceries. And these grocery prices tend to be higher because of the few suppliers that they have and these transportation costs. So it does push families towards cheaper, less healthy food options. And although there are food pantries like the Douglas County Food Pantry in Tuscola, that do provide quick, convenient meals that are usually nutritious for these residents, their supplies are really based on donations, so it's not really consistent week to week. And some of these pictures are from the Kirby Foods in Tuscola. And for example, the dozen of eggs is $4.49. And so as of late 2025, the average price for a dozen of eggs was between $1.90 and $2.53. So it is a little more steep here at Kirby Foods. And then my last picture I wanted to show is how much processed packaged meats there are on the bottom of the shelf, but on the top we only see a bit of corn and a bit of these fruit platters compared to all the processed packaged meats we have on the bottom, just to show the types of things that they have available for these residents.
So now we have subsystem 2. This is going to include public transportation and activity and the strength of those. So one of the public transportation that is a big strength is Dial-A-Ride. It's going to be available Monday through Friday from 8 a.m. to 5 p.m. and it's based on a cash payment base. And you make the reservation on your phone. You call a number and can make your reservation. They do have a website that is very easy to read on the phone. I found it's easier to read on the phone than it is a computer, which is convenient because a lot of people tend to have their phones just right there on them. The payment, it is payment in cash. So for above 60, it's going to be donation based within the county. If you're getting transportation within the county, you just do donation based on what you want to do that day. If you're under 60 within the city limits or the rural town, it's going to be $2 each way. And to travel outside of the city limits, it's going to be $4 each way. That's if you're still in the county. Now, if you want to go to Coles County, Champaign-Urbana, or Decatur, it's going to be $7 each way. No matter the age, it's going to be $7. And these are not very big cash payments, which is very nice for public transportation. And they also have where you can buy a pass, and all the information's on their website. They have information about what you can bring and any question that you would have, they answer on the website. For it is also, this county is small town friendly. A lot of people grew up around each other. They know their neighbors. Since it's a small town, there's a lot of, hospitality and people just tend to get along. So you can always request a ride from the neighbor, and families tend to live close by, which is also very convenient. So for physical activities, the strengths that they have is they do have a relentless gym. This offers plans such as individual plans, couple plans, and family plans. They do offer discounts for officers as well as seniors. These memberships are actually going to be offered for free. And then the military and the first responders, those are just going to be a discounted rate. It is open 24 hours, 7 days a week, which is amazing because you get access to the gym anytime you want, which is very convenient because everybody's work schedule is different. There's also many parks and outdoor activities in the area available. Some of the examples are Irwin Park and Wimple Park. They also have a swimming pool, and with the swimming pool, you can get a pass over the summer, which is really convenient because you can use it anytime you'd like, or you can just do it based on um, per day that you want to use your pool, which is great if you invite a friend and you're like, let's go to the pool, and then you can just buy a day pass. They also have outdoor activities such as basketball hoops, pickleball, tennis, and a track for walking. This is great because some people like the higher vigorous basketball court activity, but some people just want to do something like walking the track just to get their steps in. It's also a small town, which helps walking and getting active, whether you're in the country or you're in the town. There's always somewhere that you can walk, which is very convenient and it's mostly safe.
Okay, so now I'm going to be discussing the weaknesses of subsystem 2, which is physical activity and public transportation. So to begin from our windshield survey, we have the Dial-A-Ride transport, which is that they're requested through private manners and they do cost money. So these are rides that are offered to people of the community where they can go wherever they need to go within a certain distance. And then they have to pay for the it's dependent on the length of their route and where the final destination is. So I do have a picture of that on the right. And then also most people have personal automobiles per the picture that we have here. There's vehicles seen on the main street of Tuscola where we were doing our windshield survey, which was on a Thursday morning. And there was a tractor, it looked like a work truck, and then just personal vehicles. So a lot of people do have that. And then we saw some bikes in backyards, but we didn't see any on the street. And then there are no trains or planes or transport other than freight trains, which just transport goods and not individuals. So moving on with our windshield survey, we have that we would consider the town walkable, but it is large, so that could pose as a problem for someone that has mobility struggles. If they struggle to walk or if they have a caregiver that helps them, it can cause problems for many individuals, especially elderly if they walk with a cane or with a walker. And we would consider that area walkable, but it didn't all have sidewalks. There wasn't really a good sidewalk near like the grocery store and the big area of like shops. Into Scola, which could pose as a big problem for those that aren't able to drive or don't have a vehicle. And then there were also no public gyms without membership. On the right, there is the Rally Point Fitness membership for one person, which is $59 a month, which is a pretty high fee in order to stay physically active in that gym, which is a gym in a building, so it would be safe during all weather conditions, but it is a $60, almost $60 fee, which is could be tough for people's budgets, and that does pose as a really big limitation. And then the bus is only for students. They have a bus through the school, and that's only for students going to and from school. So that's another limitation is that people can't use that bus for transport, which I acknowledge that many schools do have that, but that would be another means of transport. For the general population if it were open to them, but they cannot use that for transport. And then on the right, I also have a downtown street of Tuscola sidewalks, which are open for walking, but the only problem is when weather gets bad, we would consider that that's not entirely walkable, and those sidewalks might not always be patent as there could be holes or troubles with that. And to move on with our research, we discovered that transportation, so dial-a-ride is a great intervention, but it does have many limitations as far as costs and distance. It can also be an issue if someone has a doctor's appointment, they may be late to it, given the fact that dial-a-ride is based on what time you ask, but it could run late, just given staffing and everything like that. There are deteriorating roads and poorly structured bridges, so that increases accidents and risk for accidents and just safety issues in general for those that are driving automobiles. And then there's also improper spending. So there are roads that we did notice that there were some pretty big potholes and they were just unkept. So the spending added has not been put towards those roads, and there's been issues and they are improving, but it's still occurring where there's those potholes and just safety issues across the community. So that can pose risks for transportation. And then for physical activity on the right, I do have two pictures. There's a walking trail in Northern Tuscola, which is an awesome intervention, also a bike trail. But the issue with this is the fact that a lot of people cannot use this in the winter or when the weather is bad, or just like as times get chillier, it can be really difficult to use this for physical activity or for transport. And then I also have the Relentless Gym membership, which is $35, which is better than the Rally Point Fitness. But there's also an issue of having to pay a membership, which cost can be a big issue for members of the community. There's also lack of access to public facilities, so there are no free gyms within the area, which can be a big problem for people as the cost may not always be realistic within people's budgets. And then there's weather challenges, as I discussed before, outside during the wintertime or just poor weather in general, cold, rain, snow, anything like that could pose as a huge challenge for these individuals. And then inadequate transportation, people might not be able to get to these gyms or get to these trails given their location, which can pose as an even bigger problem, so that they might not even be able to use them, which is another large issue within the community.
Barriers that may affect our interventions are first and foremost finding someone who is willing to plan out and reach out to collaborate with the community members and the companies. The planner must work closely with architects, contractors, community members, healthcare workers, trainers, and local officials to ensure that everyone's needs are heard and integrated into the design of the wellness center. Since the community center will include multiple fields of services, clear communication helps prevent misunderstanding and keeps the project on schedule and within budget. The next barrier is figuring out how everything will be funded and how resources like screening devices, exercise equipment, and resources that will be distributed to the community will be funded. The Tuscola community already has limited funding that is used for specific public resources or certain populations like the low income or for the elderly. So adding on a bigger project may discourage the community members or companies wanting to invest into the wellness center. A third barrier is the geography of the town. While driving around Tuscola during our windshield survey, we quickly realized that the best way to get around town is by driving. There are no sidewalks for people to walk on, and clients who have assistive walking devices will experience difficulty walking from their house to the center, and no matter how close they may live, there's just no clear walkway for them. Clients can always use Dial-A-Ride, which is a reservation-based transportation system if they want to attend the community center. And something to consider about the location is when Tuscola gets cold and snowy, it will be even more challenging for older clients to walk to the community center. While there are public transportations like Dial-A-Ride, it still uses a reservation system. So that means there's just more planning involved, and sometimes caretakers or the client themselves may forget or are too busy, and they might just not call the number to plan for the next day. So, or sometimes while it's cold, more people may want to use Dial-A-Ride, and so it will be more crowded, and some people may not be able to get the ride. And the final barrier is the limited healthcare workforce who lives near the Tuscola area. Screening the clients, providing education, and other wellness activities require people who are knowledgeable about the topic to provide evidence-based practice care for the clients to achieve optimal health. But even with all of these barriers, having a multi-purpose community center that is located in a walkable distance for many residents will improve the community and is a great resource to combat the inactivity of the Tuscola community. So moving on to evaluation. The way we will evaluate our intervention is to compare the statistics from the previous years before our intervention and the statistics after our intervention. And we can compare and collect both qualitative and quantitative data by having surveys within the community. And for quantitative, we can always keep count of the attendance records, like the health records of patients, like their blood pressure, their A1C, and to see if their health is improving or getting worse after our intervention. So there are two methods of evaluations we can use. The first is called process-oriented measures. And so basically it assesses the effectiveness of our intervention. So some questions, and these will be qualitative data, some example questions that we can have on our survey is, so are people attending activities? And if they are, like what attracts them to the activities? Are there enough people shopping at the grocery stores? Are people attending screening programs that are being hosted? And we are basically testing to see if the programs we are putting out is getting responses that we are hoping for. And because if we provide activities for the community, but no one attends, it helps kind of pinpoint down what may need to be changed or if we should stop doing certain activities. Outcome-oriented measures focuses on the results of the community. So after attending the activities and the screenings tests that were provided, are people's health being improved? Are we preventing further complications of illnesses? Do the screenings help? Like, a patient who is not diagnosed with hypertension, we may screen that, every time they come, their blood sugar or their blood pressure is higher. And so we may help prevent them from officially having hypertension. Or the same thing for blood sugar, where they may be pre-diabetic and we can help them with their diet using another source from our community center to help prevent them from having diabetes and just lower their sugar over time with the help of just natural resources like diet planning. And that is it for our presentation. Thank you for listening. And here are our resources. Have a good day.